Hello, my name is Darlena Brockway, and this is my Capstone Project proposal presentation. The title of my Capstone Project is Using Predictive Data Analysis for Mitigating Public Health Concerns. An introduction to my Capstone Project. The topic of my capstone project is how healthcare informatics can be used to manage population health. My personal motivation for choosing this capstone topic is because I am from California, so I have firsthand experience of respiratory illness on the community, such as friends and families with asthma related diseases, pulmonary diseases, things like that, especially from Southern California, such as Los Angeles and Inland Empire region. So, this is a public health concern of this region. The respiratory illness and pulmonary disease of California is attributed to poor air quality and air pollutants in the state. This could be due to attributes such as wildfires, high traffic, and industrialization. Healthcare informatics can be used to identify threats to vulnerable populations. Vulnerable populations include those who live in urban cities. There's action for a resolution to mitigate these public health concerns, and these actions can be directed towards the more vulnerable populations, which are identified with the use of healthcare informatics. So, some context to my capstone project is that I will be researching specifically the healthcare informatic method of predictive data analysis. What predictive data analysis is that it's an effective tool used in healthcare informatics because it has the ability to convert data into usable information and predict data trends. Um, it can predict data trends in population health and by identifying markers and data trends. So, how that relates to population health is that the predictive data analysis can identify subpopulations within population cases that are notable, such as, for example, a subpopulation within the California population would be regional, such as Northern versus Southern California population health trends in regards to respiratory health. Most likely, Southern California, after research is done, data trends will prove that respiratory illness is more of a concern, more of a public health concern due to attributes such as higher, um, uh, denser population, traffic. Well, and that could be said for northern populated cities like San Francisco. So, this is why predictive data analysis is used to compare the two cities and their data trends and see which population is more vulnerable. So by using predictive data analysis, vulnerable populations can be identified and therefore preventative interventions can be effectively directed towards these more vulnerable subpopulations versus the general population who may not need these interventions as much. The purpose of my capstone project is to explore and research how healthcare informatics can aid in population health management. I will use a case analysis to support this argument. This case analysis will use the population of California and the public health concern of respiratory illness and pulmonary disease with this population. The healthcare informatics methods that will be researched are predictive data analysis methods. These methods include population level models and exploratory clustering. These methods will be researched and applied to this case analysis. The data that will be supplied for predictive analysis come from credible sources and relevant information such as the American Lung Association, California County registries, and ongoing research studies on the topic. The purpose of this research study is to present clinical evidence to responsible parties, such as legislators, to support public health directives, such as passing laws that will help mitigate this public health concern. This includes laws such as anti-smog and anti-pollution directives. The literature review conducted used sources of data for providing predictive analysis in the scope of California's population health related to respiratory illness. The data sources research come from credible sources such as American Lung Association, California County registries, and ongoing research studies on the related topic. Other sources of research include evidence for using specific predictive analysis methods for population health purposes. The methods research include data analysis methods such as predictive models, population level models, and exploratory clustering. This literature review supports the capstone goals of using clinical evidence to support the argument that healthcare informatics can be used to support population health management. The weakness of this literature review is that there is lack of specific predictive analysis efforts on the specific case study chosen, such as efforts towards mitigating California's population health concern of respiratory illness, but there are other evidence of using predictive analysis for mitigating public health concerns, and this evidence can be applied to this case study. These are the references from my literature review. Thank you for listening to my presentation.